Tom. I think that, sort of how common, a lot of the terms and ideas and the acceptance that, trauma, a lot of people have trauma history, and that, that help is okay, that it's not a, if I have diabetes, I need help. If I have cancer, I need help. If I have depression, I need help. It's right. They're all issues. They just look differently, but they all need help.
Welcome to the CCCNews Podcast. Today we have a special guest, Al Barton, with Executive Director of the Mid-Columbia Center for Living, the public behavioral health provider for Wasco, Hood River, and Sherman counties. He's a licensed professional counselor with a master's from the University of Arkansas. Thank you for coming today, Al.
Thank you so much for having us, Tom. This is I'm really excited to be here.
Awesome. So you joined the Center for Living in 2008. Rose through the clinical leadership and became an executive director in 2022. So, wow, quite a range of career there. You now lead the efforts to strengthen the local care from a 24/7 crisis and mobile response to deeper regional partnerships, so people can get help closer to home. We're going to talk staffing, Medicare, federal cuts possibly on the horizon here, and access. How does Oregon, rate when it comes to access and stacked up against other states? And then maybe the whole a little bit on the whole spectrum of behavioral health care here, both locally and maybe on a state level and that kind of thing. But thank you again for coming.
Yeah, thanks again.
I read some fascinating things about you. I hear you're a hiker.
Oh, yes, that's true. Okay,
yeah. You like to bike?
Yes, like those,
Skiing?
Yeah.
Cross-country skiing?
Yes.
Yeah, so you're the full, the quadruple threat here recreationally.
I'm not sure maybe threat of going slow, but it's one of the reasons to be in the Gorge, right? It's such a beautiful place to live, and for me, the opportunity to have meaningful, purposeful work, and then have all these recreational opportunities for me is always, I tell people this is a place to be. Come out here.
Exactly, and I read a little bit too more about that, which kind of flows into that is ski patrol. Mount Hood a couple years.
Actually stepping away from that, but I did it for a number of years, and so I guess I didn't have enough, scary, exciting things to do during the week, and so I, for many years was a ski patroller at Teacup Lake, which is the local cross country ski, and so people kind of ski patrol for cross. Well, we didn't have nearly the cases that that like a commercial ski area would have. You have people with a lot more velocity, but it was really a great opportunity.
But even in your recreation, you're kind of creating that safety net, right? Well, public service. That's really cool.
It was very different. I know. In many ways, it was a big commitment, and I just realized I needed in the interest of, we try to tell everybody about taking care of themselves, and I just had to realize what I was able to give, and that's one thing I had to step away. So it was kind of bittersweet, but thanks for you've done your homework.
A little bit,
What else is coming?
Well, we were chatting a little bit earlier before we got started, and you were telling me a little bit about your day, and I was telling you about mine, and you were talking about generally having someone who is needing a residential treatment bed and trying to find them a location, which is kind of I don't know if a daily thing, but I'm sure a weekly thing in helping local folks with behavioral health or folks maybe feeling crisis and that kind of thing. And I kind of in on my side of the thing, I have a relative who I look after a bit, and we were kind of talking about that daily checkup and making sure folks are kind of going down the road straight again today, just kind of need that little bit of extra help every day, whether it's behavioral health or that kind of thing. Tell me a little bit about that, far as access goes.
Sure. Yeah, I'd be happy to. So, we are the community mental health program for these three counties, which entails, there's a lot of state rules that govern what we're supposed to do. So, counties have to have a public health department. They also have to have a community mental health program. And in some places, the county itself, like Deschutes County or, Columbia County will take on those duties. And in other places, especially in Eastern Oregon, they will delegate those duties to others. And so those duties, what are those? It's quite a lengthy list of, it's sort of like when you go to the restaurant. You can't order off the menu. We'll do a little bit of this and a little bit of this, but we can't do this. There's just a list of requirements, and all of them share that they're really about the most vulnerable, the most at-risk members of our community because of behavioral health problems. So, and at the sort of the first priority population is what you talked about, Tom, which is people in acute behavioral health crisis, which, if you've had, I'm sure most of us in this room and probably most of your listeners, we have, unfortunately, some lived experience. Maybe we know somebody that we care about, maybe ourselves. That could be, suicidal thoughts sometimes, and, which for some people may be more common than others, but sometimes folks get to that place where, they've maybe taken an action, or they've made threats, or they've, started to engage in behaviors that really concern other folks around them that love them, that care about them. Sometimes behavioral health crises can take the form of harm to others. Sometimes some folks are, because of the way that their brain is working, the signals that they're getting from the world, they might misinterpret others' motives as threatening. And so I think there's a lot of misinformation because, in our experience, we treat a lot of folks with serious mental illness. Most of them are some of the most kind and docile and easygoing. The last thing they would ever do is hurt somebody. In fact, they tend to be more often times exploited or victimized themselves, because they, someone, moves into their apartment, or someone, uses their food stamp card, or someone, gets them involved in a scam. And so they tend to be the vast majority, again, from our organization's perspective, of those folks with serious mental illness are, again, some of the nicest. They used to be in this building we're talking about, just some of the most amazing people, period. But there are times and places where folks with mental health problems do have thoughts of harm to others. And that's, we don't want to, diminish that. Again, while it is generally quite rare, when it does happen, that's another piece we need to. And then the third piece is that what most of your listeners probably experience, which is folks with a really serious mental health problem that is impairing their ability to thrive or their ability to function. Like it's freezing cold and they're not dressed appropriately, or it's, they're putting themselves in an unsafe situation. They depend upon a life-threatening or life-sustaining medicine, and that medicine, they think it's toxic. Their belief system, the cues that they're getting from the world might be different from those of us in this room. So those three people, behavioral health crisis, and we find, statistically, I should get my statistics. When I was involved much more closely with those, about 65% of the time, locally, when we respond to somebody in one of those three types of crisis, they don't need to go to a psychiatric hospital. They don't need to go, to have law enforcement present. Most people can, it's one of their worst days, and they, their family comes and rallies around them, and they regret, what they said or acted or did, or, folks who are on the street or maybe, in harm's way, it's sometimes a relatively simple solution, basic needs like housing, quick access to medicines, a rapid follow-up appointment. So, 2/3 of the time, and I can't say this for the rest of the state, but most people, we can, in the community, solve that, or at least move that crisis to a place where they're not in a hospital.
65% of the time?
Yeah, that's about,
okay.
And I should get an updated, those were probably
Close. Yeah.
2020, 2022. But there are those times and places where, just like anything else, sometimes, if I break my arm, I can probably, go see a doctor or nurse practitioner, and they can cast it up and splint it up, and off I go. But sometimes I need a hospital, right? If I need surgery. And so in behavioral health, it's kind of the same. And sometimes people do need a higher level of care. And in Oregon, that is really challenging from time, and especially in our rural communities, because we just don't have rapid access to that level of care when somebody needs something that we can't do in the community. So
Yeah. And I've seen some recent statistics on that, and the data sometimes comes out and they'll rank states, far as accessibility goes. And where does Oregon fall into that ranking? Like, far as, like number one for accessibility and number 50,
What would be your
Yeah.
Most people's impression is, well, I guess Oregon's probably in the middle, or maybe,
I would.
But no, we're actually 47th in the, so Oregon really struggles. Now, we'll provide some caveats. There are, any statistic always asks just as many questions, but, at least for latest published, Oregon has a very high rate of mental health and substance abuse compared to other states. Not the highest in that capacity, but we really struggle with, when you're in pain, you need help, right? Whether that's physical pain, emotional pain.
Yeah.
And so, if I fall down and break my arm, I want somebody to help me. And so I would go to an emergency room and they could probably help that. Some folks, we can do that if they're in a behavioral health crisis. A lot of folks we can't. And so when they need that help, and so when you say access, that's really, that's just a simple question of, hey, I need help. How quickly does that help happen? And there are expectations for our agency that within 7 days, when somebody needs help, that we did sit down and say, Tom, what brings you in today? If they're in crisis, the expectation is within 2 hours that we respond to them and at least try to do an assessment and say, Tom, what's going on? What brings you in today? So, and there's been a big pivot to mobile crisis, really trying to swim upstream and prevent people from, there's a time and a place for hospital, if someone's cut themselves or ingested something or they've injured themselves, they need medical stabilization. But, if I'm having a hard day, I can walk into Center for Living and, and urgently someone will drop everything and come see you and talk to you about, especially if you're having those thoughts about hurting yourself, maybe about others, if family members or loved ones are concerned about someone. If you're in crisis, a walk-in, we really are trying trying to do this mobile crisis.
Is that the location at 1060 Weber Street?
Yes.
There,
Yep.
right near the fire station and Kramer Fields and all that, so people can walk right in there, especially in a crisis situation, and get some.
And that would be during business hours. After hours, you could call our number or the 988 number. And then in Hood River, we're at 1610 Woods Court.
Yeah,
over by Dutch Brothers and
and then in Sherman County, I have a 903 Barnett Street and Klondike Room 107. Is that?
That's correct.
Okay, great.
That, we do serve Sherman County. We don't have quite as many service providers as, of course, we would have here in the Dalles. About 65% of our services happen here in the Dalles and Wasco County.
Okay.
About 3 to 4% in Sherman County, and then I'm not good at math, but whatever's between 4 and is left in Hood River. Hood River, and all those counties, will have their own particular challenges. So,
very good.
Yeah.
Okay. Well, hey, tell you what, I want to hear a lot more about this, especially how Medicare is looking and that kind of thing. But we need to go out, hear a message from our sponsors, and we'll be right back.
Okay, great.
Hey, friend. If you're having a tough time right now, you're not alone. Whether you're dealing with stress, mental health challenges, emotional pain, or concerns about alcohol or drug use, there's someone here ready to listen. Just dial or text 988 anytime, day or night. The 988 Suicide and Crisis Lifeline is here for you 24/7, 365 days a year. It's free, it's confidential, and it's available to anyone. Yes, even if you're reaching out for someone else. The counselors in 988 are trained, caring, and judgment-free. They're ready to talk, to listen, and to help you or someone you care about get through a difficult moment. You matter, your story matters, and help is just 3 numbers away. Call, text, or chat 988 anytime, anywhere.
All right, and welcome back to the podcast. We're talking with Al Barton with Mid-Columbia Center for Living today. And we were just kind of starting to chat a little bit about what the horizon holds far as funding goes for behavioral health here in Oregon and nationally. There are federal cuts up in regards to Medicaid and that kind of thing. And can you kind of do you have a sense of that? Can you pull out your magic crystal ball today?
I left it behind. Shoot, let me go get it in the car. No. Great question. I think this is something that, no matter what type of healthcare is involved, obviously there's a lot of eyes and concerns about what the future holds. And, I think the things that we do know is that there will be, the most recent federal legislation, will have some work requirements. And so, Medicaid, is a publicly funded health insurance program. Oregon, when I started many years ago, 70% of the folks locally had insurance. Now it's up to like 94%. So Oregon really went in on this model of, hey, let's get preventative care out there. Let's really get people access so that, that they can have a routine counseling appointment or a routine appointment with their physician or their dentist instead of waiting until you get really, really sick and then you need to go to the hospital, which is expensive.
Yeah.
So anyway, so we know that there's some work requirements, which will, when that's been implemented in other states like Arkansas, that it's resulted in a shrinkage of the number of people who are eligible for Medicaid. And then we know that in the future, the bill also contains language about the eligibility, because there is an income, right? I need to, if I'm going to apply for Medicaid, I need to demonstrate, what my household income is. And if I have, a lot of children, that's going to change it. And if it's just me and, all those types of things. And so Oregon will now be required to. So I think, it's hard to predict. I think, there's some predictions that, it could be 5 to 15% reduction. There's some kind of larger, projections that, especially the interesting thing is in our rural communities, if you look at the rates of folks on Medicaid, it can be very, very high, as we go to our east. It can be, 20, 30, sometimes 40% of the individuals in that community are on, get their
some sort of support for Medicaid. So fascinating. When Representative U.S. House Rep Cliff Bentz was here last week, he was talking about that work requirement, and that was going to be a 20-hour per week to maintain your eligibility. And then the other thing, was proving your income, that you're at that 130% poverty rate or below, I guess is the way to say that.
Yeah, those are typically the two criterion. And so, again, it's pretty hard I think most of those changes, my understanding is that in, 2020, so nothing's, the Oregon Health Authority put out as soon as the bill passed, some people were like, do I lose my health insurance tonight?
Right.
No, it doesn't change, but we expect in 2026 and 27 that those changes. So I think it's very hard to say, Tom, it's going to be exactly, 375. Well, I don't think we can be that precise, but I think we can prepare for the fact that there's going to be less individuals who have health insurance. And so, I can't speak to my counterparts in the physical health world, but we, our services are in many ways like emergency medical services or police and fire. It's a safety net that we as taxpayers, we give money to those services. They don't generate a product or revenue other than our safety and wellness. And so, for us, there's direct funding agreements that if less people are on Medicaid, we would have less money in the bank. And so, we've made real concerted efforts to try to get ahead of that and to try to be, and to try to make preparations. Obviously we don't want to scare our entire workforce to say there's going to be no one, and no insurance. But, and the flip side is that we've recognized when there's less folks with Medicaid, people still have behavioral health problems, right?
They don't go away.
Right. They may just not have insurance. And they still, then in that case, what they tend to do is turn to the public systems like Center for Living or community counseling or Deschutes County. And so folks who don't have Medicaid or any type of insurance, they still are having a hard day. So we have the ability to see people on a sliding fee. So even if they're uninsured, we will try our best to see them. Right. We do have to follow federal guide and state guidelines, but because we try not to turn folks away just because of money or insurance, we expect that, it could be challenging in the world, that there could be more demand for our services and less resources to pay for them. So, how do we make decisions today that hopefully, allow us to thread those needles, as it were, in those straits? And so, I'm trying to tell myself that this is an adventure, but it is, I'd be remiss not to say it's daunting and very concerning.
Yeah.
It's not quite, things are going to fall apart tomorrow. No. And not quite, these things happen. I mean, somewhere in between those two extremes, something will be different, and we can expect that there will be less, individuals with Medicaid and less, funding for those types of resources.
And that feeds into rural hospitals. This was a part of Bentz's presentation the other day, that essentially he's looking very hard at the rural hospitals in his district and how to most benefit them, like with what resources remain. I think there was a certain amount in the bill that passed, the OE, was it the one big beautiful bill or whatever?
I think that's the name it's called.
That there was some caveat in there for a certain amount that could be shared amongst the states to help help those rural hospitals. But like in our community, say for instance up at Venice Hospital, like they have only so many facilities they can utilize for somebody who comes in with an acute situation, right? And so it just I guess my point in saying all that is again lower resources
And if if there are less insurance to pay for some services, then those hospitals are going to go. Again, I'm not an expert in hospital, how they fund their services.
Sure.
And, I mean, I do understand. Obviously, I think all of us are, no matter what your political beliefs are, that fraud and waste and abuse and the system. I mean, I can understand the impulse, and by no means am I taking a political or partisan position. But our role is just to educate based upon what we know, and those are the things that I've been, and my counterparts throughout the state. That's the information we've been given to the best. But it would be things will be different, and we will. Again, we're a mission-driven organization. We're not we don't want to go anywhere. Where we plan to be here to serve our community, but it'll be different, and what the resources we have in the future might be. It might be different.
In my head, I'm always trying to square what the cost is up front. Like, and we do want people to be eligible and people to meet the requirements to get services and that kind of thing. But I also in the back of my head, am thinking about like, well, if somebody goes to a facility and they're really hurting, they need to get that service then, and it's like you can't wait for is your insurance in place, or is there funding for this? Like, I mean, somebody who's in crisis needs crisis now, regardless of what the funding situation is. And I always worry that puts it in a situation. It's kind of a no-win. Well, if I go ahead and help somebody, well, then we're running in the red. And if I don't help somebody, boy, that's really a really poor option. So I kind of always am trying to square that. But when we were talking a little bit earlier, and this kind of runs into that, is you were saying that Oregon had made great strides in getting folks insured through like Pacific Source and some other insurance companies that also provide some. But that also is there's a little bit of uncertainty within those markets as well, as far as the insurance goes. Can you talk to me a little bit about that?
Sure. And I'm not an expert in but Oregon, we have Medicaid is a federal insurance program, and the federal government provides money to Oregon to administer its Medicaid program, and then Oregon, the Oregon Health Authority, right, contracts with various what are called coordinated care organizations or insurance companies. Pacific Source, Eastern Oregon Coordinated Care, Health Share. There's a lot of Lane Care. There's a bunch of them, 16 or 17 throughout the state. There was an article in earlier in the last week, just really talking about that they're sending signals not really related to the things that you were just talking about the federal level, but that, the good news is that if we wonder, why does Oregon have such poor, why don't we have great access to care? I think the investigation yields that we just really haven't invested the resources in developing those preventative systems of care that prevent people from going to hospitals and stuff. And so, anyway, the coordinated care organizations sent a letter talking about that. The good news is that the state changed the rates for behavioral health care, which is good. That means when the rates are higher, we can pay counselors and therapists and psychiatrists, and we hire a lot of peers and recovery mentor people with lived experience. That we can pay folks at a different rate because we can bill for a higher rate. So that's great. They also really expanded the network of providers. If you have your insurance, you might look in the back and say, well, Tom, here's the dentist you can go see. Here's the 2 or 3 dentists. When they've really opened those networks was just a fancy word for saying, well, now more providers, professionals can see people. So higher rates, more professionals. They've really questioned. And then people are seeking out behavioral health care, which is, again, most of us would agree that's what we want. Right? We want people to get care is about, hopefully people use it. But I think the unfortunate thing is that the entities that contract with agencies like ours are concerned that what we're spending on behavioral health care exceeds what they're getting from the state in reimbursement. So, unrelated, I guess sort of related, but not exactly related to any of this federal stuff, just the local insurance companies. So, that adds another
element,
a darkening element of, I don't know what that would mean. I think that would steer your listeners to look at some of those articles. I'm happy to bounce them to you if you don't have them.
You said that was a Lund report?
Yeah, the Lund report is a kind of a healthcare related newsletter. And they published on the 21st. And they cited one of our local here in the Gorge, Coordinated Care Organization. Pacific Source is the Medicaid insurance company for most people in this region. There are a few that go elsewhere, but anyway, so that is. And then we contract directly with those folks. And so, if they're experiencing financial distress, are they going to pass on that distress to us as a provider and the rest of the providers in the region? That is very concerning. So both those paint, again, not a horrendous picture, but clearly a concerning and darkening picture of, we should be really prepared. How do we try to get through this? And I think the way through it is collaborating with our key community partners and trying to, are there partnerships and ways and messages that we can share, meeting with elected officials, educating the public on, what the consequences or ramifications may be. There's things we can do. We don't want to, just wait and say, well, I guess it's going to be bad. Right. And then how can we, make sure that our organization is financially stable, right, as we get through these times. And so, that'd be remiss on our part if we didn't do that to kind of, when storms happen, you got to weather and, so that's that's an area of concern. I think and that's just been the last couple of weeks that we've really learned about that piece, but it kind of
interesting times.
That's a good way to characterize it. I'll go with interesting.
Very good. All right. Well, tell you what. Hey, let's take another break. We'll go out to our sponsors and we'll come back. We'll talk a little bit more.
Thank you.
Right. Hey, Josh, did you know that we are funded by our readers in large part?
I did know that, but please tell me more.
Yeah, it's our local readers here that make it possible for us to go out and gather news on local businesses and important issues in our community. And so we need people to support local news. Did you know you can make a difference in our community's economy and culture by supporting local journalism? I bet you did. But maybe you out there don't. And so you should visit our Support Us page at CCCnews.com to subscribe to a monthly donation to keep news local and start making a difference in our community today. Again, that's CCCnews.com.
And remember, CCC News is available for everyone and funded.
All right, welcome back to the CCC News Podcast. We're here with Al Barton, the Executive Director of the Mid-Columbia Center for Living. And the Center for Living has 160 employees, and you have outpatient mental health. You have, community support services, peer services, cottage drop-in. And maybe you can explain a couple of these things, but also alcohol and addiction support.
Yep.
And and then a partnership with Hood River Acute, post-acute. Is that?
We do. We have an enhanced care service program over in Hood River.
Okay, great. So generally looking after the health of our community, behavioral health of our community, which is a big thing to do. You guys have had your hands full in the last several years. But kind of one of the most recent things that came up was the push for a crisis resolution center campus here in the Dalles, and that unfortunately did not quite work out due to some kind of the rules regarding those facilities that are receiving federal funding. But you guys have kind of pivoted, and if you'll tell me a little bit about your scaled plan about a crisis receiving facility, and maybe your ideas of where that might be located, not specifically, but maybe community-wise, or
sure, yeah. And this is a continuing to evolve discussion, just because, we really appreciated the partnership with Wasco County. They really stepped up. Even though we serve all three, Wasco County had some space here, which, as we know in the Gorge, is premium, right? There's not a lot of it around. And so we've engaged in this partnership, and it was a real big setback. The vision originally was to build a campus model that had if you think about what we call levels of care, right? Just like, some people need a skilled nursing facility. Some people need a hospital, right? Somebody needs an intensive care unit in a hospital. Some people need independent living. They live on their own, but somebody checks in. Behavioral health care is no different, right? Those levels of care exist. And so the thinking was to build a number of those programs that are residential in nature. The Oregon State Hospital is really struggling in Oregon with finding placement for a lot of its folks. There's not room for people to step down when they're done at that level of care. And so we thought, okay, there's none of that in the Gorge currently. There's smaller little communities to our east that have some of those services. Let's do that. We can do that. And again, it was a very spirited partnership, but it
had a lot of momentum. I believe there
political
was
momentum, money,
and Sheriff, Elaine McGill was working really hard at that, and
we're indebted. I mean, I just can't say enough about how Sheriff McGill. Yeah. Again, he championed that for many, many years, and it just became the barriers became untenable, and it would be probably the rest of the afternoon talking about some of them. But the bottom line is that, there are a combination of some rules and some billing requirements, because these things have to pay for themselves. We don't want to, impose upon the counties or the taxpayers to fund them. And so, it was a real setback to see some of that. So, then we, like you said, pivot's a good word to try to see if, could we do some of these resources? Because, if somebody today is struggling with drinking or drug use, right? And they go to see a drug and alcohol counselor. We employ a bunch of amazing ones. We have some really, really good ones. They do an assessment and they determine, this person, Al Barton, needs, he can't just, he really can't stop drinking. He needs to go to what they call rehab or residential care. Well, there's none of that in the Columbia Gorge, right? You're going to have to go to Portland. You're going to have to go to Redmond. You're going to have to go to Bend. You're going to have to go to, Klamath Falls or Ashland. So how could we build? We know that there's a number of folks just in our community who sometimes need that level to quit their drinking or drug use. Hey, could we build that here? And so that was the pivot, is let's build a residential drug and alcohol center. And so that still is, we're working on with our board. Wasco County is still a key partner. They just, again, have been, I can't say enough of appreciation for how much they've stepped up to meet the, counties don't have to do this, but it's in their citizens' interest. They have plenty on their plate, but they just, Tyler Stone, the Wasco County Administrator, has just been a great thought partner and collaborator to try to put these things together. So the latest, greatest was, could we build this drug and alcohol center? Could we build a lot of people? We were talking earlier about behavioral health crisis. If you cut your hand, you don't necessarily need to go to an emergency room. You can go to like a Zoom care, a drop-in, Adventist, Columbia Gorge Family Medicine. These folks have an after-hours drop-in clinic where, I don't think I should wait, but I don't want to necessarily walk into an emergency room. So it's sort of this mid-range level of care. And that's what these receiving centers are, is it would be, again, if you walk in, I'm having a hard day. I'm worried about my loved one. Maybe my teenager has said some suicidal comment. Do I call the cops? Do I ignore it? What do I do? I need to talk to somebody. You go to a crisis receiving center where you get a rapid assessment. And then these receiving centers will have, like the one in Deschutes County in Bend there's a chair and someone can stay there for up to 23 hours. And so, it's not quite treatment, but it is, it's supervised, an opportunity for somebody. Maybe substances are involved. I can sober up a little bit. My family comes and, I'm so sorry. And oftentimes that's what recovery looks like when you're in acute crisis. Is it can be really quick. Like people, they sober up or they start to think about, oh gosh, if I died, that would be terrible. And, their mom comes around and I love you. And, it can be very touching and compelling to watch that healing happen and so rapidly. But anyway, could that happen today? It oftentimes either happens in a home or on the street or in our offices. But would there be a safe, neutral place that isn't a hospital, that isn't a jail, that isn't a mental health facility? And so that's these receiving centers. The challenge with those is that there's no way today for us to bill and fund them. And so that makes it hard. And so, we'd be really going out on a limb. We know it works. We know it diverts people from the emergency room. We know it's a cost savings to taxpayers, but we really need that opportunity because, if we say we're going to hire Tom and Robin and Al, and then it's like, oh, how are we going to pay Tom and Robin and Al? Right. So that becomes, and of course, with all those things we just talked about, it paints a cloudy picture about taking risks right now. So stay tuned. This journey is continuing. And what, if you had asked us 3 or 4 months ago, it would have been like, we've got money, we've got a partnership, we're going to do this. Now we really have to be honest about, what can we take on and what risks do we want to take in a time of state and federal darkening clouds.
Right.
And so it again, it paints a
atmosphere.
very different picture than we were a year ago. We were, full steam ahead. And so anyway, so to be continued, but, that still is possibly on the table. The great, we've had some great political leadership. Senator Helfrich was a real champion for, bringing some of that resource locally. So, Greg Smith from out in Eastern Oregon, both again, how can we get those resources in the Gorge? Again, not to call on those elected officials, but when they step up like that, we want to really appreciate them. Right. And so we, stay tuned. We'll see where that development goes.
Yeah. Also, on a note of flexibility, wildfire support. So the folks, in Rowena, endured the terrible fire this summer in June. And it sounds like you guys have posted resources and an announcement offering support for the community and that kind. Can you tell me a little bit about how you guys have addressed that?
Yeah, thanks. Boy, good. Yeah, great question. Again, just a heart-wrenching loss, right, to our community. My understanding, the second largest loss of property in Oregon history. We don't think about, we know that people lost their house, and, I work with people who lost their homes. We know, obviously. When that happened, again, Wasco County Emergency Management System reached out because, oftentimes there is a behavioral health and emotional, there's a safety issue and smoke in my house, but also like, what do I do now that I've lost my home? For a lot of people, that would be the worst day ever, right? And so, if I've lost pets in the fire, just some of the stories are
it's
just
hard enough moving,
right?
Could you imagine? No, nothing's left.
Yeah. Tom, we're going to take everything, and now you need to go stay in a hotel with your dogs.
Yeah.
And so, the resiliency of the community, but also, just attending some of those meetings and just seeing kind of the, the rawness of people who just. It's one that your head can get around it, but seeing folks who've really experienced that level of loss. So anyway, just, appreciate the state and Wasco County's response. It was a lot of work for them. Anyway, and there's a behavioral health component. And so, we partnered and really just how can we help? And, I really want to credit our deputy, Jamie Preston, really kind of spearheaded the effort. Again, I'm really lucky, Tom. I show up and you show up and you have amazing people you work with. It makes where we were 3 or 4 years ago, where we are today is just vastly different. And so, really, in fact, there's an event happening tonight, a listening event.
Yep.
And so, we want to be present because oftentimes what we find in those situations is obviously there's an acute, safety issue, smoke, your house is gone. But what we find is that as that reality sets in about, oh my gosh, I'm going to have to rebuild my whole house. And now that's gone too. And now that's gone too. That can take days and weeks. And so what we're finding is that folks still, days and weeks after that is when what they call the surge happens, oftentimes emotionally or psychologically, is that, really the reality starts to, the first couple of weeks, I'm just in kind of survival mode and what's going to happen. And then becomes that, oh my gosh, this is going to be a long road. And maybe do I have the resources? And so we are finding that, and that's typically what happens, what they call a surge, kind of similar to the waves in the ocean. There's a big surge after the event has sort of faded from all of our consciousness. The news isn't talking about it as much, but it's still, people are still struggling with that. So
it's kind of like after the funeral, everybody goes home and you're like, oh, now what am I going to do?
Yeah, that's it. And so, if folks are really struggling with that, just know that help's available. Again, even though we're talking about all these resources and, we're here to help again, and that doesn't have to mean talk therapy for years and years. It can mean just a check-in, especially if you're in really acute distress, especially if you're having those thoughts about self-harm or, am I going to make it? Please reach out. We have some amazing staff members, and we're here to help you. Again, Fantastic. Can we make everything? We can't get people's houses back, but we can at least try to support you emotionally and at least understand what can happen. So thanks for bringing that up. And I'm super proud of our team. Years ago, we wouldn't have been able to have the resources to support, but again, those investments that Oregon made allowed our agency to really step up. And when that happened, to stretch and to help the community, because that's...
Did you any feeling on the number of folks that you all were assisting after the fires? Do you have a feel for it?
I don't have an immediate, but I know I just talked to one of our staff. 3 days ago, somebody came in and just talked about, they were victimized, I guess that's the appropriate word, but they were affected deeply. They lost their house, and they were finding that they were really, especially, one of the risk factors is if I've had, prior trauma or loss, maybe I'm not as ready to deal with a new one, like losing my house. And so oftentimes, yeah, that's a great question. I'm not trying to dodge your question.
No, it's okay.
So 37 or 2, or I don't know the answer, but I know there has been clearly an increase in the number of people.
All right.
But I love being challenged with good questions with data. So let me dig in, and I can probably
you can come back and we'll
ballpark and say, we've had a number of referrals related to that. So
excellent. Yeah. Another note too. You guys had a pretty big move back in January. Your children's services relocation expansion went up across the street from Adventist Hospital. There. Is it in the kids' dental zone building?
It is that same place.
Yeah.
Yes.
Okay. Great. Up there on 19th Street. 1935 East 19th Street, the Dalles. So, and that was adding space for therapies, or can you tell me a little?
Sure.
Yeah.
You bet. Again, most of our services, as we were talking about, we have to do certain things like crisis. A lot of our services are really focused on folks to seriously mentally ill adults, right? We have a lot of jail diversion and specialized programs that try to really keep people well and in their communities. But a big part of our work is children's services, young people, preventative, but also, there are a lot of young people in crisis and in challenge. And so, kids who are at risk of out-of-home placement, maybe foster cares on the horizon, maybe they're involved with the juvenile, youth services, maybe they're having troubles in school. So a huge part of our workforce is really geared towards intensive services for children. So that can include, again, all the way from, at the lowest level of severity, like counseling every 2 weeks, sitting in an office, and, maybe a young person's having some minor struggles with depression or anxiety, all the way up to, they just got out of a psychiatric hospital and they are coming back to their community. How do we wrap around a number of professionals to meet that family, not just the young person, in their home? So a lot of our services are really in the community. It's not in an office. We're going to be at your house, right? We're going to be in your living room. We're going to be at the school with you. We have some amazing school-based professionals because, there's been a big surge in post-COVID with the mental health of our young people. And so, so those services include routine counseling. It can include intensive services, maybe a couple times a week, that we meet with you. There's some really specialized programs that, again, we really think of them as kind of our safety net services that really are trying to prevent people from, waiting until they're needing that hospital or that, residential treatment. There's a time and a place for that, but hopefully community mental health programs keep families in our community. And so most all those services are up there. So they're, they were all crammed into 2 offices. And the good news is, again, the state spent money on resources. And so we hired, I think there's 45 people in our children's program. We have some great leaders, some amazing staff too. It's heartwarming when I get to meet those folks when they come on board. And they deal with some of the most challenging, families with multi-generational histories of trauma. Granddad had problems, grandma had problems, mom and dad had problems, poverty, lack of access to care, abuse, neglect. And so, they tend to be very, very challenging cases. And the good news is that when, a wraparound team approach with a doctor or a nurse practitioner and a case manager and a peer, it really takes kind of a village kind of thing. Yeah. Rather than just, I'm going to see Tom every week, 2 weeks for counseling. And so, all those folks are there. And the nice thing is that, it is, before it was great when we were all under one roof, but if I'm bringing my family for an assessment and I've got this, 8-year-old who's kind of nervous and I walk up and here's all these adults sitting in the lobby, I might be a little uncomfortable. Whereas, if I go to a child-friendly space like, up there, so it was really, there were a variety of reasons for that move. One, we just ran out of space. Good problem. That building didn't house all of our children's team. 2, it builds a really child-friendly and welcoming space, I could be there for my teeth, or I could be there for a medical. I think the medical maybe have moved, but or I could be there for mental health, and that's that. There's still some of that stigma. People don't want to. Maybe sometimes mental health services maybe are embarrassing, or I should just deal with it. But if it's more anonymous, that's just a better
I think that's becoming less and less, and I think the vocabulary is expanding. And I think when you point to things like the increased coverage and insurance, I think people are at a much better point. At least it seems like in my lifetime, in acknowledging these things and getting help. It's
Sure.
like
No,
super important.
I think you're right on, Tom. I think that, sort of how common, a lot of the terms and ideas and the acceptance that, trauma, a lot of people have trauma history.
Yep.
And that, that help is okay, that it's not a, if I have diabetes, I need help. If I have cancer, I need help. If I have depression, I need help. It's
Right.
They're all issues. They just look differently, but they all need help, right?
Yeah,
And there is despite all those darkening clouds, I want to paint a hopeful picture that, the professionals that I work with, again, I'm super fortunate to be surrounded by some super capable people. We have some amazing people that are really mission driven, want to help, and really produce good outcomes. There's some, does counseling help? I mean, it's not a fix all, but there are clear interventions. Sometimes people need a medicine. Sometimes people just need talk. Sometimes people need to learn skills in their home. I work with a lot of amazing folks who provide that service to our community each and every day.
Yeah, and thank you for doing what you do and keeping your staff going and morale up and all that good stuff. What an amazing conversation. Thank you, Al. I really appreciate it. And you should come back. We should do an update.
You know me, I've got a lot to say, but just the opportunity to promote not just what we do, but there's others that do this throughout the state. And I really appreciate your guys' message and mission. And so thanks for taking some time to share
Absolutely.
ours.
Yeah. And let us know if the financial sides of things, they're changing and that
Be
kind
one of the first to know.
Okay. All right. Well, thank you so much, Al.
You bet. Thanks so much.
All right. Hey, Robin, I just did a story this morning about my daughter who's hiking the PCT.
That's special. I love that.
Yeah, and she's a 2019 grad of the Dallas High School, and she's doing this kind of awesome thing, and I'm so proud of her. But also at the same time, I really enjoy bringing local news to folks and bringing relevant information.
That's really evident from your work, Tom.
Yeah.
Yeah. I mean, the internet is full of misinformation or poor quality information or AI produced information. And here we have something different at CCC News, right? We're local people generating local content with journalistic integrity and trying to build trust with our audience because that's what they deserve, right?
Right. And so how does that benefit our advertisers?
Well, being seen next to content that's really relevant, that's really trustworthy and really credible adds credibility to our advertisers because our viewers and readers see those advertisers next to that really honest, credible local information, and it really builds that brand into a basis of trust and really helps businesses reach people from that basis of trust.
Yeah, awesome. And boy, and to all those folks who are supporting us, it makes a huge difference in us being able to get this job done of keeping folks informed of what's happening in local government, entertainment, all sorts of venues throughout the Gorge.
Yeah, we have really high integrity in our journalistic standards, and so you're always verifying all this information constantly with multiple sources of people. We don't try not to do one source stories here, or just take a piece of information from the government and run with it. We really try and drill down and get to the meat and potatoes of what's there.
That's the joy. Yeah.
That's great. Well, if you want to keep reading, go to CCCnews.com. And if you want to support us, look for our Support Us tab there. And really grateful for any support that people can make. Yeah. The more support we get from our local audience, the less we have to rely on advertisers and the more journalistic freedom we get.
Yeah, absolutely. And those interested in advertising can always reach out to me at tom@cccnews.com or call me at 541-980-2756.
Great. Thanks, Tom.
You bet.